Behind every classroom outburst, every sleepless night, and every quiet withdrawal, there is often a deeper issue, one that far too many families never get the chance to address. Not because they don't care, not because they don't notice, but because they don't have access. Access to answers, access to care, access to hope. Imagine being a parent who knows something isn't right, but can't find anyone who will listen. Imagine facing insurance denials, waitlists that stretch into years, and systems that speak a language you don't understand. Imagine having to choose between paying rent and paying for therapy. Now imagine that someone changes all that. This is the mission of the McCrory Center, to break down barriers that prevent families from getting the mental health and developmental support they deserve. From our beginnings in Michigan to our growing impact across communities, we've stood for one unwavering truth: every family deserves access to quality, compassionate, and culturally relevant psychological care. This video is more than a story. It's a movement. It's a deep dive into why mental health accessibility matters, what's standing in the way, and how we're changing the narrative one family at a time. Welcome to Breaking Barriers, making mental health services accessible for every family. Access is more than geography. It's more than affordability. True access to mental health services is about connection. It means services that are not just available, but reachable. Not just nearby, but welcoming. Not just in your language, but in your culture. We often hear that services exist, but they don't always serve. Clinics may offer therapy, but only for those who can take time off work. Specialists might be available, but only for those who speak the right language, or can afford out-of-pocket fees, or have the transportation to get there. Access, in the truest sense, means shorter waitlists, flexible appointment times, telehealth options for rural or mobility-limited families, clinicians who understand your lived experiences, services that meet you where you are, literally and emotionally. The McCrory Center was built on this principle. We don't just offer services, we remove the barriers that keep families from receiving them. From home-based visits to mobile evaluations and teletherapy, we've reshaped what mental health accessibility can look like. And most importantly, we treat every individual with dignity and respect, because access also means feeling safe, seen, and supported. Let's talk about the real obstacles. Mental health care is often out of reach due to a complex web of barriers, financial costs, even with insurance, therapy, evaluations, and ongoing support can be financially devastating. Insurance limitations. Not all providers accept all insurances. Some families face long waits or out-of-network costs. Transportation, in many neighborhoods, even getting to a clinic is a challenge. Stigma, mental health is still surrounded by shame in some cultures or communities. This can discourage families from seeking help. Language and literacy, forms, appointments, evaluations, they're often not accessible to non-English speakers or those with limited health literacy. Work schedules, standard office hours don't work for parents juggling multiple jobs or single caregivers. Cultural disconnects, services that don't reflect a family's cultural background often miss the mark, leading to mistrust and underutilization. These barriers don't just delay care, they prevent it altogether. At the McCrory Center, we've seen the heartbreaking effects of this. Children misdiagnosed, families turned away, parents blamed instead of supported. That's why our approach is different. We don't wait for families to come to us, we go to them. We ask what they need and then build solutions around that. The McCrory response: real solutions, real results. We listened. And we acted. Here's how the McCrory Center is actively removing barriers and redefining access. Community-based services. We began by embedding services directly in neighborhoods. Home-based evaluations. On-site consultations. School partnerships. We need families where they are. Multilingual and multicultural care, our team is trained to serve families from diverse backgrounds. We offer materials in multiple languages and hire clinicians who reflect the communities they serve. Sliding scale and pro bono services, cost shouldn't be a gatekeeper. That's why we offer flexible payment options and no-cost care to qualifying families. Telehealth services, virtual sessions allow us to reach families across Michigan and beyond. Especially during and after the COVID-19 pandemic, teletherapy became a lifeline for many. Holistic evaluations are psychological and developmental assessments consider the whole child cognitively, emotionally, socially, and environmentally. No rushed checklists. Just real insights. Cultural competence. We don't just acknowledge culture, we embrace it. Our clinicians are trained in trauma-informed, culturally responsive care. We know healing happens when clients feel safe and understood. Parent empowerment. Every family receives not just answers, but tools. We equip caregivers with strategies, resources, and guidance to support their child beyond our sessions. These aren't just initiatives. They're lifelines. They're the reason families trust us. Stories of hope. Families finding a way forward. Every statistic has a story. Every barrier we break leads to a breakthrough for a real child, a real parent, a real family. Maria's story, a Spanish-speaking mother with 2 young children. Her son showed signs of autism, but no one would assess him because of language limitations. We stepped in, providing a bilingual clinician, conducting a culturally responsive evaluation, and guiding Maria through support options. Her son is now thriving in school, with services that match his needs. James's story, a father who lost his job and couldn't afford therapy for his daughter who had just witnessed a traumatic event. We offered therapy on a sliding scale, and within weeks, his daughter showed signs of emotional recovery. The foster family, 3 siblings placed in kinship care after being removed from their home. Trauma, anxiety, developmental delays. We provided evaluations, coordinated with schools, trained the caregivers, and ensured every child got what they needed. They are healing together. These stories are just a glimpse of what happens when barriers are removed and care is delivered with intention. Access starts with outreach. At the McCrory Center, we don't wait for families to find us. We find them through strategic partnerships, grassroots community engagement, and culturally sensitive outreach. Our model includes school collaborations. We embed services in educational settings to identify needs early. Faith-based partnerships. We work with churches and religious organizations to build trust and deliver care in welcoming spaces. Community events, screenings at health fairs, resource giveaways, educational workshops. Pediatric and OB clinics. Early childhood mental health begins before birth. We support parents from pregnancy onward. We also train professionals, teachers, nurses, social workers to recognize signs of developmental or emotional distress and refer families early. Outreach is more than marketing. It's mission in motion. The role of cultural competence. Cultural competence is not an optional skill. It's foundational. Families don't just need support, they need support that understands who they are, where they come from, and what matters to them. Culturally competent care means asking, not assuming. Respecting traditions, languages, and values. Recognizing systemic inequities and historical trauma. Celebrating strengths, not just treating symptoms. At the McCrory Center, we approach each family with humility, curiosity, and care. We recognize that culture shapes everything, from how emotions are expressed to how healing is experienced. Our staff undergoes regular training in cultural humility, racial equity, and implicit bias trauma-informed practices. LGBTQ+ affirming care. This isn't just policy, it's how we build trust. And trust is the foundation for every successful intervention. Building the future, equity in action. Access is only the beginning. Equity is the goal. We are actively building a future where every family, regardless of income, race, language, or zip code, can receive high-quality mental health care. Our vision includes expanding our workforce with providers from underrepresented backgrounds, launching a mobile clinic to serve remote communities, partnering with universities to train the next generation of culturally responsive clinicians, advocating for policy changes that prioritize early intervention and mental health funding. We don't just imagine a better system, we're creating it. The McCrory Center is more than a provider. We are a movement for mental health equity. If you believe that no child should suffer in silence, if you believe that every parent deserves support, if you believe that culture matters and access should be a right, not a privilege, then we invite you to join us. Support the mission. Share the message. Refer a family. Become an advocate. Together, we can break the barriers. Together, we can build a world where healing is possible for every family. Because when one family thrives, a whole community rises. This is the McCrory Center. This is breaking barriers.